HCG increases estrogen through the intratesticular testosterone. I would say you can do, let's say, every Monday now, 100, 150 or 200. Disadvantage for spiking the hematocrit, but also the estrogen. So you get super high.
Some patients don't want to inject that frequently. Other patients prefer having a set on one exact day per week. Well, not to mention that if you have...
In people within replacement therapy, estrogen is beneficial. Okay, we shouldn't block it.
I guess it depends on the right ester for the right person, right? When I didn't have my Sustanon and the Greek Enanthate was there when I was in Greece, it agonizes the estrogen receptor, so it's going to be affecting the liver.
4 days, 5 days, while Cypionate 8 days, therefore.
Have you seen testosterone propionate used in other ways? Have you seen 25 milligrams daily?
Now, in bottles it comes at 100.
It does come in 100 in 2 ml.
So let's say 0.1 it is 10 milligrams, all right? If you do it microdose with an insulin syringe.
You don't reckon?
But usually it's in Italy comes 2 ml at 100.
100 milligrams in 2 mLs, and it also comes 25 milligrams per 1 ml. And at the Hormonist pharmacy, we supply 25 milligrams in 1 ml because it's exactly.
If I had access to the Hormonist, I would use propionate on a daily basis.
Yeah, would you? Okay, so there are some benefits, and I considered it as well. I just don't want to inject as frequently. So the next ester would be testosterone, let's say Cypionate.
Cypionate it's widely used in the US. It's a bit slower than the Enanthate, and it's perfectly to be used once a week.
Okay.
That's the perfect
What
range.
dose once a week?
I would say 200. Well, you're gonna spike with 200 in one dose.
We can also go with 100 once per week. You can
Connor does.
100 every
Thomas
5
Connor
days.
does 100 every 5 days.
Yeah.
I would say you can do, let's say, every Monday now, 100, 150 or 200.
Okay. So what there are? I guess it depends on the right ester for the right person, right? Some patients don't want to inject that frequently. Other patients prefer having a set on one exact day per week, and they know that day. Other people are better using the calendar, and they set the calendar to do every 4 days, every 5 days, every 6 days, every 7 days. I think it just depends. So have you seen a difference between testosterone Cypionate and the next ester, which is testosterone Enanthate?
No, they're very similar.
Yeah, they're usually interchangeable, aren't they?
Enanthate is a little bit faster.
Absorb more quickly. So would you think it gives you a bit more of a spike or a peak? Or it's quite same?
Very similar, but in Greece we have Enanthate. All I'm using is Enanthate.
Okay.
Pharma grade. Yeah. And then we have the Enanthate, which is very slow, 60%.
So undecanoate is known as
the libido. Yeah. It's around to be used every 2 or 2.5 months, 8 weeks, 10 weeks.
Yeah.
The longest
is
12 months or 3 months, 12 weeks or 3 months.
So with undecanoate, we're talking it's a whole 1,000 milligrams in one go.
Yeah, this is a major disadvantage for spiking the hematocrit, but also the estrogen. So you get super high the first month, it kicks around second, third week. Right before injecting again the 12th level at the 12th week, it's around 300. So you don't have a steady.
So this is the argument.
Spikes and then it troughs, and you don't feel well before the next injection. So you should bring it sooner, all right, around from 12th week to 8th week.
And this does happen sometimes in clinic. I mean, what amazes me about the undecanoate, libido or Avid in the US is that, it's not that new of a molecule. I mean, it came out undecanoate, as was the Andriol.
Yeah, but surprisingly, Andriol has a very fast half-life.
It's supposed to work through the lymph. So you would take that, and that was supposed to slow it down. And so suddenly, by the manufacturer adding 4 milliliters, or 1,000 milligrams in 4 milliliters, somehow people think this is just going to be amazing. It's going to increase the duration. But if you give, and yes, it has a low startup, right, low ramping up period, and it lasts a lot longer. But I suppose if they used to do 200 milligrams of Cypionate every 2 weeks.
Yes, so 125 per week, which is a good dose in order to be below 1,000 nanograms per week. Okay, that's what I'm using every 7 days actually, half cc.
Of
Enanthate. So yes, if you take 1 gram in 2 months, you're gonna have 125 per week.
Okay, so I mean that can work for some. I think it just depends on what they're prescribed. Sustanon. Let's talk about
Sustanon
Sustanon.
is a blend.
It's a blend of the different esters.
It has a very fast-acting propionate, but also a slow acid, the andecanonate. So it enters the system, but it clears the system slowly.
And then I think the longest one is the testosterone decanoate. It doesn't have undecanoate. It's
Decanoate, no
testosterone
andecanonate.
propionate, phenylpropionate.
Isocaprate.
Yeah, I say caproate, and then undecanoate.
Yeah.
So that's
So you feel the difference fast with injecting. It gets into the bloodstream.
but it's the testosterone propionate of the Sustanon mix is the lowest level. I think it's quite misunderstood. I think in the UK, Australia, other countries throughout the world, the Netherlands, other parts of Europe, there's Sustanon, but there's also Omnidrin, which is essentially the
Omnidrin in
same,
Poland, yes.
but it's exactly the same formulation now as the Sustanon.
I think there are 3 blends in Omnidrin.
4. It's the same exact combination as Sustanon now. That's a good question. So how long does HCG take to increase intratesticular testosterone?
While on TRT?
Let's say, as a monotherapy. So they just did HCG alone. Now, the experience why HCG isn't used alone.
Monotherapy, but it shuts off the LH.
Yeah, it shuts off your LH. So there's really no advantage when you compare it to testosterone, other than you keep your testes going. But it takes a lot more HCG, wouldn't it, to get a similar amount of elevated testosterone levels as would an injectable testosterone. So you can do 100 milligrams every 5 days with testosterone cypionate. It may take, 500 IU of HCG about every other day, maybe to get it close to the levels that you would reach with the injectable testosterone. What do you think?
Well, when we use HCG as a part of the PCT protocols in bodybuilders, we use it every 3 days, that's the half-life. And I'm telling them to use 5,000 to 6,000 IUs. And then after 2 weeks, they feel a great kick in libido, in mood, even in strength. So after the second week, they feel the difference.
5,000 to 6,000 IUs.
Totally,
Total.
Totally.
Divided
So dividing
through
5
the
doses
PCT.
or 6 doses of 1,000.
Okay.
So we do kind of a small dose, microdosing, every 3 days.
About 500 IUs.
2,000.
2,000 IUs.
Every 3 days.
Every 3 days.
Yes. And during the second week, they feel the difference.
Okay, so it does bring up but it's a lot of HCG to use.
I wouldn't compare apples with oranges.
Yeah.
I mean, it's like comparing a knife with a gun. I mean, testosterone is the real deal. It cannot be substituted by anything. Now, bring them together, if they join HCG, it's much better also. Because you don't shut off your own production, your balls are still alive. And also it's a libido enhancer during TRT because this intratesticular testosterone will give you more sex drive.
Well, not to mention that if you have the cost involved, having testosterone and HCG can sometimes be more, but if it's actually, because you're using a smaller dose of HCG, it's not as cost prohibitive as if you had to use a massive dose of HCG.
I'm doing actually 100 IUs every day. I break it down as Chrysler used to say, John Chrysler, that mimic your own production of testosterone with small doses of HCG.
One type of person that couldn't use HCG would be those who have testicular damage. Right? If you're primary hypogonadism,
or perhaps seminoma, testicular cancer survivors.
Yeah, because then there's not a whole lot to produce.
But you believe that in testicular failure in primary hypogonadism, HCG has no benefit?
I think that's very little. If your testes aren't going to take a signal from your LH, which is better, and FSH, why would it do any better with HCG? Enanthate is more estrogenic than cypionate.
No, actually, it remains in the system 4 days, 5 days, while cypionate 8 days. Therefore, there are more chances of cypionate to aromatize. The opposite. The sooner it clears the system, like propionate, for instance, it doesn't aromatize.
They're nearly identical.
It's 71 to 68, but if you search out the half-lives, it's 5 days to 8 days. And also aromatization is up to the dose, okay? Also,
exactly. How much dose you
adipose
take in one
tissue,
go.
ethanol, soy, okay?
Well, probably your first step is try to get, the one thing I've heard from some doctors is just increase the total dose, but there are still some men who may not convert, and we've seen this. It's rare, but we've seen it a few times.
I would add HCG.
You would add more HCG, and then if that didn't work, a synthetic estrogen, or bioidentical estrogen probably as a cream. And they do make estradiol injections as well, but maybe a little bit of cream to help with that.
It's counterproductive.
Well, clomiphene.
It works in the paper, but it raises LH.
So
total testosterone, HCG, free testosterone goes down. So it's counterproductive, especially in large doses. Crystal said 12.5. In very low, it may work. But if you increase the dose, you feel lousy. You have retinopathy, blurred vision. And also, it's...
Well, the issue with some like Clomid is it agonizes the estrogen receptor. So it's going to be affecting the liver. You're going to, you're right, raise SHBG. You have some pro-estrogenic effects, and then you're going to have some anti-estrogenic effects in the brain. So Clomid is a tricky one because not everyone feels better.
And also they trigger clotting, the SERMs, huh?
Yeah, and potential clotting with SERMs, yeah. One of Dr. Mark Gordon's programs for TBI, he is a big proponent of Clomid. Remember Dr. Mark Gordon? So for those who had traumatic brain injury, he was using a clomiphene to help stimulate the brain, plus adding a bit of testosterone into the mix, no more than about 60 milligrams.
I would say HCG is superior to Clomid, to the side effects, and to the efficiency in the testicles.
Well, I think people subjectively feel better with the HCG or exogenous testosterone than they do with Clomid. Estrogen, high estrogen, increase the chance of infertility in men.
Now, usually the high estrogen shut off GnRH for LH.
Yeah, it's part of the feedback loop.
Yes, yes. And in such case, you have less testosterone that matures the sperm. In 90 people, okay? Now, in 90 people, this way. Now, in people within replacement therapy, estrogen is beneficial, okay? We shouldn't block it.
Of course. So you're doing TRT, HCG, and will the increased HCG, which causes increased...
I guess not, because HCG increases estrogen through the intratesticular testosterone, and HCG improves fertility. I wouldn't see a negative factor of estrogens during the fertility because this is what HCG does.
Well,
indirectly,
increases, estrogen increases.
Yes. It depends on the lifestyle somebody wants to use. Okay, if you want the perfect microdosing, I would say is the cream.
For doing
the lesser spike. Okay. If somebody travels a lot and is not convenient with injections, okay, do it with anticonate every 8 weeks, I would say.
But for the general population, I mean, we've seen in some of the...
If I had propionate in my country, I would use propionate to avoid the spike and elevate my SHBG.
SHBG.
My SHBG, yes.
I think we see, at least in the UK, quite a large number of patients using Sustanon in varying degrees every 5 days, similar to the Cypionate. And I found personally, when I switched from Cypionate years ago, when I was in the States, to Sustanon, it was nearly a 1-for-1. But I've done as well as...
Have you tried the Greek Enanthate?
I've tried the Greek Enanthate. I've tried the different Cypionates. Yeah, they're very comparable. When I didn't have my Sustanon and the Greek Enanthate was there when I was in Greece, I didn't miss a beat. I used the same exact dosage I was doing with Sustanon with Enanthate. I didn't notice any difference with either of those.
It comes in 200 or 250?
It comes 250. One of the brands in an ampule, 250 in 2 mLs of olive oil and ethyl oleate. So it's a combination of mostly olive oil and ethyl oleate, and that's made in Italy. Well, it's licensed in Spain by an Italian company. It's also made in 100 milligrams in 2 mLs. But there's a 250, 100 milligrams in 2 mLs. From the United States, there's 2,000 milligrams in 10 mLs, and there's 1,000 milligrams in 10 mLs. So these are the different options that are available mostly throughout the world. I know there's a few other ones. So what is the optimal one? Similar to dosing, what's going to be best for the individual patient? And I think it's a way up of cost, convenience, what's available in your country. And I think that, for me, I've got a choice between all of them, and Sustanon seems to be one of my favorites with that one. But again, it just depends on what works for most people, and what we've seen is that seems to be working the best, but there are many other options that we have, especially at our pharmacy. If you like content like this, do click like and subscribe and hit the notification bell if you want to get our latest updates for when we drop content. It really does mean a lot. And until next time, to your wellness, this is Mike.